Now this is a very interesting X-ray. If you can see, when you zoom in into the X-ray, we can notice that the lung shadows are very, very, very blurry. Uh, so when we see that there is perihilar significant congestion, and you can see these white lines which are like going from the hilum towards the periphery of the lung. These are more of a dense white lines. We can see that it is going up to the periphery, and that is all originating from the kind of hilum. Here also, if you can see, this can be very crystal clearly made. These are white lines which are going up from here, and it is going up to the periphery. So this is the whenever there is significant perihilar congestion in bilateral lung fields, which starts from this hilum and goes towards the periphery of the lung. It is very, very typical of pulmonary edema. And pulmonary edema suggests two things: either it is heart failure, or it is heart failure which is associated with fluid overload. So you can very well see that there is this uh, white, thick white or radio dense white linings which are going toward the periphery, which usually suggests that there is congestion in the interstitium, because as there is this radio opacity or this whiteness is because this lung parenchyma, which was more of a blank or vacant, is now filled with so much of water. So these alveoli are more of a filled with water. The interstitium outside this alveoli, they are more of filled with water. So there is water everywhere. There is congestion everywhere. That is the reason why the X-ray, the lung fields where it should appear more of a black, it is all filled with dense white, hyperdense, whitish, long lines like lesions or lines, which actually spread through or spread across the bronchovascular markings. So these bronchovascular markings are all almost disappeared because of this type of white lines. And this has to be bilateral if you want to call it as the pulmonary edema. Now, a similar kind of structure will be seen with ARDS, but for in ARDS, usually what you can see is a nodular pattern, a typical nodular pattern you can see in ARDS. This is kind of a reticular pattern, means there is kind of linings which are there. So linings or reticular pattern is much more commonly seen with pulmonary edema, whereas this nodular pattern can be seen with ARDS, even though this thing or this type of findings is also seen with ARDS. So just to differentiate or just to have an idea, okay, this is more of a pulmonary edema than ARDS. To call it as ARDS, you must have involvement of at least 3 lung fields, like 1, 2, and 3 out of 4 lung fields. Now in this X-ray, there is one more interesting thing. When we compare the hyperdensity or radiodensity, this appear radiolucent compared to this appear hyperdense. But here there is so much of radiodensity. There is so much density because there is something else here as well. Now when we compare in both the lung fields, we can very nicely make out that especially in this area, this radiodensity has markedly increased. And there is one structure which is here, this is basically a patent bronchus. This is a bronchus. This lining is of bronchus. And there is a black shadow which suggests that there is air inside. So this is in short a air bronchogram, which typically suggests that this is a consolidation patch. So air bronchogram suggests that it is a pneumonia. It is a consolidation. That is the reason why this is much more hyperdense, this is much more radiodense in uniform way, whereas here you can see some sort of lung parenchyma, But here you are not able to see there is a complete patch, because we must know that consolidation mainly involves the alveoli. So all these alveoli, which are usually air filled, they are all blocked by or filled by this protein liquid or protein secretions exudates. That is the reason why they will appear uh, complete radio opaque or whitish. So you can see this whitishness, it is all white, whereas here you can see there is some air inside, but the it is associated with some accumulation of fluid in the interstitium, in the alveoli wall, around the bronchoscalar markings. So that is the reason why there is radiolucency as well as radiodensity, whereas here there is uniform homogeneous patch, a well defined patch with radiopacity and with presence of this air bronchogram, which is very nicely visible. So it suggests the consolidation, that is pneumonia. So this was a patient with dense pneumonia plus pulmonary edema. So for pulmonary edema, these patients will need invasive or non-invasive ventilation and diuresis to remove all this pulmonary edema fluid. Thank you.